So my name's Dr. Andrew Lipton. I offer a practice in Narberth outside of Philadelphia where we give holistic and natural options for any health challenge. Basically, one of the most common presentations I have is when people come in with indigestion. Now, when I say indigestion, it could be a broad sense of symptoms. It could be reflux and people having heartburn and gastroesophageal reflux. It could be abdominal pain. It could be bloating. It could be irritable bowel. These all come under the indigestion. In general, when you consume things, there's a few things that can happen that can cause adverse reactions. The first thing that many people are aware of is you can have food allergies. You can be allergic to wheat or gluten sensitive. You can be allergic to dairy. You can be allergic to peanuts. If you consume something you're allergic to, you can have an immediate reaction around the mouth. You could have swelling. You could have effect of the breathing and a histamine reaction throughout the body, which could cause an itching or rash. But it's an allergic reaction. And basically, there are testings to do for this. You can do food allergy testing through blood tests. Typically, what we recommend is food allergy testing of your most common foods. So if you don't eat it regularly, then you probably shouldn't check it. And we routinely check things like celiac and dairy to see if people are allergic to them. But sometimes people find that things they eat on a regular basis are actually causing an allergic reaction. The next thing after an allergy, for basically the treatment is avoidance of allergy products, would be something along the lines as reflux and heartburn, and gastroesophageal reflux is a common example where people belch or burp or have bloating or indigestion. When you put a food in, if you're not having an allergic reaction but you don't digest it well, it sits in your digestive system, your stomach and small intestines, and your body's unable to digest it, and it basically ferments and putrefies and produces byproducts of gas and fuel for bacteria that are normally in there. This can produce the body to say, hey, I want to empty my stomach, make more acid, but your body can't digest it, so it's a vicious cycle of making more acid, having reflux symptoms, and the main treatment, traditional medicine, is using antacids like a Tums, H2 blockers like a Pepcid or Tagamet, and the traditional medicine used now is something like a Prilus, like a proton pump inhibitor. For our health, it all begins with the gut. And so if we are not digesting or assimilating well, our body can lose the ability to get nourished and absorb nutrients. So long-standing digestive issues can produce health issues in other parts of the body, including the skin, the heart, the endocrine system. So if you're not getting the proper nourishment because your body's unable to digest something, the health consequences can be far-reaching. The third area of dysfunction in the gut comes under the term food sensitivity. This is not an allergic reaction. This is not an ability to digest. So you can eat it fine without an allergy. You can digest it fine, but the parts that you digest or parts of the food cause inflammation. And this is a more difficult problem to find out the cause. There are known inflammatory foods. Some people that have arthritis may react to nightshades, a group of plants including tomatoes, peppers, and eggplants that cause joint inflammation. And so that's a known sensitivity. You're not allergic to it, you don't have a problem with digestion, but it causes joint pain. So we use sensitivity testing through a company and a test called ALCAT, and they basically measure up to 200 different foods in your red blood cells to see if your cells are reacting in an inflammatory manner. So one of the classic ways to define this in the past was called an elimination and rotation diet. And you achieve an elimination rotation diet by basically pulling a common food out of your diet for 4 or 5 days and then adding it back in and seeing if the removal or addition change your symptoms. Meaning if you have a dairy issue and you pull it out of your diet and you feel better and then you add it back in and then you get bloating or gas or indigestion, it's pretty clear that's the cause. But you have to give it 4 days off and you have to then re-expose it. So each food takes the better part of a week to determine. The ALCAT testing allows you to check for hundreds of foods at one time and be able to create a food list of these foods are inflammatory and these foods are not inflammatory. Now, let me specify that this is not an allergic reaction, a sensitivity. It just means it causes inflammation. If you'd like to find out more about food allergy testing, about enzymatic digestion processes, or about food sensitivity testing, please contact our office.